I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina. The title of today's talk is You Won't Eat GMO, but You'll Put This in Your Eyes, Part 1. StimulEyes. FDA approval status? We're just invisible. StimulEyes is the biologic eye drop which is made from amniotic fluid. I was able to persuade the manufacturer to give me their recipe, which consists of 1/2 cc of amniotic fluid combined with 5 cc's of normal saline. And this is a 9% solution. You can buy this at dryeyerescue.com, and a 1-month supply costs $229. I don't know if there's tax, shipping, and handling on top of that. Dry Eye Rescue says this is a 1 to 2 month supply, so I guess you can stretch it out if you want by using it less often, or squeezing out a very tiny drop, if you can manage that, from the large dropper tip. What does the StimulEyes website have to say for itself? It says that StimulEyes is a chemical-free solution to relieve dry eye disease. Indications include dry eye disease, aqueous deficient dry eye disease, evaporative dry eye disease, and blepharitis. So compared to its competitor Regenerise, StimulEyes is much more bold, upfront, and direct regarding therapeutic claims. First, the photo album biopsy. And Snail says, we knew this was coming because Dr. B just loves looking at Facebook photos of advertisements. This is a definite therapeutic claim, a non-chemical solution for dry eye syndrome. And I have to point out that based on the condition of her skin, this model is about 10 years old. Another claim to relieve dry eye disease. Notice the last sentence where it says that growth factors may improve positive outcomes. I don't think the may will really save the manufacturer in this case because they clearly state that this product will relieve dry eye disease. Maybe they want to create a little bit of mystery about exactly how that happens. And here we have definite relief of various symptoms, including inflammation, dryness, pain, photosensitivity, and more. And this is a high-value personal testimonial from an optometrist who's using the product herself. Well, let's go from the StimulEyes webpage to my favorite webpage, DailyMed. Does StimulEyes have a DailyMed listing? I checked all 3 plausible spellings, StimulEyes, no hyphen, StimulEyes, 2 separate words, and StimulEyes with hyphen. No results. In each case, no drug package label was found. And that's why you've heard me make the joke more than once that StimulEyes is just invisible. And StimulEyes, of course, has the disclaimer. Information and statements on this site have not been evaluated by the Food and Drug Administration. And this is probably the reason why they get away with a 1-page provider package insert. So I really feel like this should completely end the conversation about the regulatory status of StimulEyes. It has not been approved by the Food and Drug Administration. Period. Before viewing the next section of this talk, the Snail suggests that you review FDA drug approval for biologic eye drops, parts 1 and 2. Everything after will make much more sense. What is in StimulEyes? They have a magical matrix with growth factors and bioactive proteins. All of these long, complicated words here are describing different types of proteins. And they talk about their protein viability. Why is StimulEyes better than Regenerise or any other biologic-based eye drop? It's because there is very high protein viability, even in the absence of preservatives. And that's actually a pretty funny statement because you can't mix preservatives with proteins. It explodes them. So there's no even in the absence of preservatives. There is only you can't have preservatives. Here's the StimulEyes webpage for patients when they say that clinical trials are not required. Since the FDA absolutely requires clinical trials before approving your drug, what the manufacturer is trying to tell you is we don't need FDA approval to sell this. If you see that little icon in the upper right-hand corner, that's my smoke and mirrors call out to tell you that the manufacturer is engaged in some tricky language to persuade you to believe something that's not true. What the webpage says is that amniotic fluid is a safe and effective tissue for use in research and clinical trials. Well, a couple of objections to this. First of all, the FDA is in charge of the phrase safe and effective. You don't get to use it whenever you feel like you want to. Also, by law, amniotic fluid is not a tissue. The FDA has a definition for everything, and amniotic fluid is a secreted product, not a tissue, and this matters a lot. Also, no claims about it being safe and effective for the typical dry eye patient who's purchasing this product to treat their dry eye or blepharitis. If you're not taking part in research or you're not a human subject in a clinical trial, the manufacturer is making no guarantees at all, no statements of any kind about whether their product is either safe or effective for your personal use. The lawyers must have noticed, because in late May of 2022, some new language appeared under FDA regulations. You are encouraged to report any negative side effects of prescription drugs to the Food and Drug Administration. So please do so. And also, please email or call the Dry Eye Foundation and let us know that you've experienced a negative side effect and that you have reported it to the FDA. If you try to use MedWatch and you start to lose hair in frustration, Rebecca can talk you through it or give you an easier contact method. Let's take a look at that tiny package insert. The tiny package insert was sent to me by the manufacturer. They sent it to me as a PDF because for some reason they were a little bit reluctant to simply send me a sample. On the left, we have the web page with the matrix of StimulEyes, marketing, regeneration. On the right, we have the package label. Labeling, we didn't mean it. M2 Biologics makes no claims concerning the biological properties of its allograft tissue. It's not a tissue, it's not a tissue, it's not a tissue, but okay, you can call it a tissue. We get the point. You're not making any claims at all about its biological properties. Wow. That's a transition. Here's what the tiny package insert also says, that current technologies may not preclude the transmission of disease. What kind of diseases are we talking about? Well, nasty viral diseases for the most part, HIV, hepatitis B, hepatitis C, West Nile virus, syphilis, not exactly a virus, and gonorrhea, also not exactly a virus, but possibly floating around in amniotic fluid. So basically, you could get a horrible incurable disease, but don't blame us because we disclosed the risk. So Snail says, hey, package insert. Doesn't work, might kill you. Are we done with this talk? And I say back, I haven't quoted the FDA or the CFR yet, right? So no, we are not done with this talk. My fun happens next. M2 Biologics is playing games with the Code of Federal Regulations. I've got a screenshot here with a lot of small text on it. You can pause the video and read it, but the key word is conversely. M2 would like you to believe that there is a difference between unnatural exosomes derived from laboratory cultured cells. An exosome is basically a suitcase that is filled with proteins. These unnatural exosomes are regulated under Section 351 of the Public Health Service Act. Conversely, their natural exosomes come from amniotic fluid. They're regulated in some different fashion as a non-HCTP biologic. But those of you who have watched the videos about FDA regulation of biologic drugs know that these are actually the same thing. All biologics are regulated under PHS, Section 351. So this is smoke and mirrors. PHS Act, Section 351, and Title 42 of the United States Code, Section 262, are actually the same code. Yeah, it is really confusing. But the key is that this code does not talk about HCTP at all. Those regulations are found in, wait for it, Title 21, Section 1271, which is actually in the Food, Drug, and Cosmetic Act. There is no mention of Section 1271 in that previous paragraph of smoke and mirrors. The manufacturer is really just trying to distract and confuse you and make you give up on the whole idea of whether or not this product is FDA approved. If the feds regulate saline solution, they're not going to ignore proteins from strangers. And Snail notes, the FDA is actually really mad about amniotic fluid and exosomes. And this is where they express their displeasure. They say there continues to be broad marketing of unapproved products considered regenerative medicine therapies. These products require FDA licensure and approval and oversight in a clinical trial. Doesn't matter whether they come from your own body or someone else's. And specifically, they mention amniotic fluid and exosomes. They're regulated. They are. Clinical trials, FDA approval, biologics license. StimulEyes has none of those things. So the recap. StimulEyes contains filtered amniotic fluid, which does not contain cells, hopefully, but does contain exosomes, and maybe really bad viruses. They're not making any promises. Therefore, StimulEyes contains proteins, just like their web advertising says, the matrix. Proteins are regulated as biological products under PHS Section 351. Therefore, an eye drop which contains proteins is regulated as a biologic drug. The FDA is in charge of biologic drugs. And yet, StimulEyes is completely invisible to the FDA. They don't even have a pretender over-the-counter DailyMed entry like Regenerize does. Okay, a tiny bit more CFR because I could not resist. We've talked in some previous videos about misbranding. Misbranding can happen in a couple of ways. The one we've emphasized the most is when a manufacturer makes unproven therapeutic claims. But a misleading label in general is misbranding, and in specific, if the label fails to reveal the proportion of or other fact with respect to an ingredient present in such drug, when such proportion or other fact is material in the light of the representation that such an ingredient is present in the drug. Okay, let's all go lay down, all right? But the short one on that is that nowhere does M2 Biologics confess that StimulEyes is a 9% solution of amniotic fluid, but you're buying it for the amniotic fluid. So the failure to reveal the fact that it's a 9% solution is quite material and constitutes another form of misbranding. Part 2, when regenerative medicine is sort of like a Hollywood movie.